Okay, so the next topic of today's conference is effect of cosmetological treatment, but this time I used sonophoresis with green tea, bamboo extract, and lactic acid on acne skin condition. As we know, the acne vulgaris is the most common disease, and it can affect up to even 19 and 100% of people aged 11 to 25. Of course, factors that may influence, we've been also speaking about this on my last presentation. It can be genetic factors, excessive activity of sebaceous gland, hormonal factors, Cutibacterium acnes, excessive keratosis of sebaceous glands, and also excessive activity of androgens. Lesions that may occur due to acne include whiteheads, blackhead, pustule nodules, and cysts, also papules, and they are located at the T-zone and on the forehead, nose, and beard. Also, in females, we can see this lesion also on the cheeks, and at men's sex, we can see on the back. Additionally, symptoms such as pain, irritation, and skin redness may occur. And also, I was conducting research about the quality of life persons with acne vulgaris, because it's not only a problem of our appearance, that we don't look good, that we have acne lesion. Also, we need to remember that people struggling with dermatological disease, here with acne vulgaris, the quality of life is getting worse, and it's getting really low. Sometimes even patients have problem with depression. And in many researches, we can also read about suicidal thoughts. What about ultrasound? Because I was using them in my research. These are elastic waves. The application of an active acoustic wave is physical matter cause biological, physical, and chemical changes. In cosmetology, we're using ultrasounds with frequency of 750 kilohertz to 300 megahertz. They mainly cause micromassage of tissue elements and leading to local hyperemia and a beneficial effect of the functioning of lymphatic system. In sonophoresis, the active preparation or ampule is combined with the ultrasound gel, and then we are applying this on the section before performing the procedure. Drug penetration is mostly like from 1 to 2 millimeters depth, and sonophoresis is increasing the absorption of substances and activates cellular metabolism. In my research, we used a green tea. It is both the leaves and buds of Camellia sinensis plant. The active ingredients of the green tea are polyphenols, and they have antimicrobial, anti-inflammatory properties. Also, we used bamboo extract, and bamboo is a plant native to Asia, and its young shoots contain silica, amino acids, and proteins, and also flavonoids. Bamboo extract has antibacterial properties. That's why we also use this in our ampule. And the third component was the lactic acid that has antibacterial function, and it also is a pH regulator. When it comes to study design, we had 60 women aged 19-23. It's one more time only women we could have in our group, because no man wanted to participate in the study. One group was a placebo group. The inclusion criteria was 19 to 23 years of age, female or male gender, and mild to moderate acne. And of course, we couldn't have any dermatological treatment. As I said, the group was only containing women. We had a lot of inclusion criteria because also of the ultrasound. The inclusion criteria was was the same for group A and B. It was pregnancy, lactation, active inflammatory, of course, allergic fungal bacteria disease, allergy to components that we had in our ampule, the green tea, bamboo extract, and acids, hormonal contraception, external and internal isotretinoin use, active rosacea, eczema, psoriasis, telangiectasis. Here, when it comes to ultrasound, we couldn't have patients with pacemaker and heart problems, and also implants like metal silicone were exclusion criteria, tendency to keloids, and any dermatological treatment. We wanted to know that our treatment gonna help to our probants. That's why we didn't want anybody to be treated by dermatological treatment. At the beginning, 97 people submitted in the study, but we excluded 37 people because of exclusion criteria. The 60 women, we divided them into group A and group B. Group A was the group that received sonophoresis with ampule and ultrasound gel. Group B was the placebo group, where we only used the ultrasound gel. They didn't have any ampule containing the plants. Each group consisted the same amount of people, 30 women. The group B wasn't informed that they are a placebo group. We've been making patients because of taking the envelopes, and inside the envelope there was a letter A or B that was making to be in one of this group. The study was conducted at my university and also in Medical College Jordanka Filaretova in Bulgaria. Of course, any other cosmetic procedures were conducted, and also our probants only use micellar water and moisturizing cream. Also, the supplementation was forbidden, like yeast tablets, sulfur tablets, or herbal teas, because we didn't want this kind of pills decrease the amount of sebum. About participants, I've told you. When it comes to measure of the skin, this time we use global acne grading system for our acne. Skin measurements were taken 3 times before the treatment, 1 week and 2 weeks after finishing 5th procedure. The participants were asked to remove the makeup the day before taking the parameters, and they've been asked not to apply any creams or cosmetics. We've been making the measurements in the morning between 8 and 12 o'clock. The conditions in the room were 20 to 24 degrees, and humidity was from 40 to 50%. Also, our patients were acclimated in the room for 25 minutes. We took the measurements thanks to Derma Unit. We used a pH meter, corneometer, and sebometer. Both groups had 5 treatments. As I said, the group A was the group that had gel with ampule. Group B was placebo group only with sonophoresis gel. Before the treatment, we removed the makeup, and then we've been preparing our gel with ampule. So group A had 10 milliliters of ultrasound gel and 5 milliliters of ampule, and group B had only ultrasound gel 10 milliliters. We've been using something is on the chat because okay. We've been using ultrasound device. excuse me, wait a moment because it was too fast. Okay, the gel was introduced on the skin, and then we use ultrasound. In group A and group B, we had the same parameters. So we had 0.25 watts per centimeter square, and the duration of the ultrasound was 10 minutes. And in every treatment was the same parameter. For home care, also we pleased our probants to use only micellar water and moisturizing cream. We prohibited any other new cosmetics, and as I said, any dietary supplements. And then we made the statistical analysis, and here you can see the experimental group and control group. Here is the global acne grading system. So you can see in the experimental group, before the range was between 19 to 25. After this 5 treatment, we had a range between 9 to 19. So it means the acne lesion was getting smaller. We had less blackheads, pustule and papules. And in the control group, it didn't change because only here in the control group, we've been using ultrasound gel, and it was placebo. Group. Here we have also number of participant, experimental and control group. We have before the treatment and after the treatment, so we can see that most of our patients from experimental group had moderate acne, and after the treatment, you can see another graph where more participants had mild acne. So it's this blue one. When it's come to changes of facial skin greasing after sonophoresis, facial skin greasing was measured 3 times. Also between the eyebrows, around the nose, and around the bottom of lip. Difference in acne severity between the first, second, and third measurement were compared between the experimental and control group. There was a significant medium effect of the group parameter on facial greasing around the nose. The placebo group showed higher level of greasing than the experimental group. However, the effect of the treatment group on skin greasing between the eyebrows and around the bottom of lip was not statistically significant. A large time effect was found when the measurement of facial greasing between the eyebrows, around the nose, and bottom of lip was performed before and 7 and 14 days after sonophoresis treatment. The first skin assessment differed significantly from the second, week 1 and after treatment finishing, and third ones. Here also we can see the graph with facial skin greasing. We have the baseline, week number 1 and week number 2. The green one is the experimental group, and the blue one is the control group. As we can see, the skin greasing is getting lower in the experimental group, where we had gel and the cosmetic ampoule with green tea, with bamboo extract, and with acid. Our study for the first time evaluated the effect of using green tea, bamboo extract, and 5% lactic acid with sonophoresis. We didn't find the researches common to our. Some researchers had, for example, using herbal peels, so it was internal, but external we didn't find. One more time, I'm saying that the cosmetological treatment can only help. We can't replace it with dermatological treatment, and we can't use it with severe form of acne. If the doctor, dermatologist, gonna say that we can make treatment like that with person with mild to moderate acne, it's gonna help also with the dermatological treatment. Also, we have study limitation. I was saying about this in my first presentation. I think in the future we can use different devices that can help us to show our results. Of course, we would like to have men in our study. And another study limitation could be to check after longer time, about maybe after 6-7 months, how the skin looks like in our patients. Here we have also some photos. Photo A and B, it's a person from the experimental group. Photo A is before the treatment, B after the treatment. And another two photos are from the placebo group, photo C before and photo D after the treatment. Thank you very much.